Good morning, everyone. My name is Syed Hamid bin Syed Ibrahim, and today I will present about the heart. This presentation is prepared for Prof. Zainal. The heart is a vital, hollow, fibromuscular organ that acts as the central pump of the circulatory system. It is roughly conical in shape and is enclosed within a protective sac called the pericardium. It sits in the middle of the chest, between the lungs, slightly to the left of the midline. The base is located at the top, while the apex points downwards and to the left. The heart's continuous pumping ensures blood reaches all organs and tissue, delivering oxygen and nutrients while removing waste products. In adults, the average weight of the heart is about 300 grams in males and 250 grams in females. The heart reaches its full size around 17 to 20 years of age, and it beats roughly 100,000 times every day throughout a lifetime. Let's talk about the anatomy of the heart. The heart consists of four chambers, two arteria and on top and two ventricles at the bottom. Blood enters the right atrium from the body via the superior and inferior vena cava and move into the right ventricle, which pumps it to the lungs through the pulmonary arteries. Oxygenated blood from the lungs return to the left atrium via the pulmonary veins and then to the left ventricle, which pump it up to the whole body through the aorta. Major coronary arteries supply the heart itself with oxygen, which is crucial because, like any muscle, the heart needs a constant energy supply. The structure of the heart with valves between chambers and vessels ensure unidirectional blood flow, preventing backflow. So, let's talk about the cardiac muscle cell. So, the cardiac muscle cells, the heart is made of cardiac muscle, also called myocardium. These muscle cells are cross-striated, similar to skeletal muscle, but they are involuntary, meaning we don't control them consciously. Each cardiomyocyte has a single central nucleus. These cells branch and connect at specialized structure called intercalated disc. The disc allows electrical impulse and mechanical force to pass quickly between cells and bring the heart to contract as a coordinated unit. Excitation begins in specialized pacemaker cells, which rhythmically generate impulse that determine the heart rate. Unlike skeletal muscle, cardiac muscle has very limited regenerative ability, so damage from events like a heart attack can be permanent. Let's talk about calcium and energy regulation. Calcium is critical for cardiac contraction. When an impulse reaches the cardiomyocyte, calcium enters the cell through the L-type calcium channels. This triggers calcium release from the sarcoplasmic reticulum, raising the cytosolic calcium level. Calcium then binds to troponin C, allowing the actin and myosin filaments to interact, which result in muscle contraction. For relaxation, calcium is actively pumped back into the sarcoplasmic reticulum by the sulca pump. Calcium also enters mitochondria, activating the Krebs cycles enzyme and producing ATP. This ensures the has enough energy to meet the constant demand of pumping blood. If calcium handling is disrupted, it can lead to arrhythmias, reduced cardiac efficiency, or even the heart failure. So let's go to the next slide. Let's talk about ABSD, atrioventricular septal defect. AVSD is a congenital heart defect, meaning it is present from birth. It involves holes between the right and the left chamber and abnormal atrioventricular valve. It is also called AV channel defect or endocardial cushion defect. The severity varies. Complete AVSD, a large central defect with a single common AV valve. Partial AVSD, smaller defect with separate valve, often causing mitral valve regurgitation. Mild partial AVSD may not show symptoms earlier and can be diagnosed later in life. This defect causes abnormal blood flow, reduce oxygen delivery, and increase the blood flow to the lungs. If untreated, complications can include arrhythmias, heart failure, and pulmonary hypertension. Early detection is important to manage symptoms and plan treatment effectively. So let's go to echocardiography. Echocardiography is the main diagnostic tool for AVSD. It uses ultrasound to create a real-time image of the heart. It helps visualize abnormal connection between the atria and ventricles and assess the structure and function of the atrioventricular valve. Color Doppler is used to detect abnormal blood flow, such as left to right shunting, and to evaluate mitral or AV valve regurgitation. Echocardiography is also allows estimation of pulmonary artery pressure and cardiac chamber enlargement. It can differentiate between complete, partial, and transitional AVSD. Overall, it guides surgical planning and helps determine the optimal timing for intervention. So, for conclusion, mm, in conclusion, the heart is a remarkable organ that works tirelessly to maintain circulation throughout life. Understanding cardiac anatomy, muscle function, calcium regulation, and congenital defect like AVSD is crucial for diagnosis and treatment planning. Echocardiography remains an essential tool in evaluating structural and functional heart abnormalities. So thank you for listening to my presentation. Once again, to everyone, thank you to the Prof Zainal for your guidance and support. That's all. Thank you guys.